Thank you so much for having me. I've been really excited to do this, and thank you for inviting me. So today I thought that I would kind of speak to some of the newer parts of my work. And I've been thinking a lot about a concept that I've elaborated called gender pleasure. And I'll explain what that is, but it has its roots in a essay in chapter 6 of Transsex, written by the sex educator Tuck Malloy. And at that time, we were coming up with a title, and they had this idea for an intervention called a gender pleasure history, and I'll talk more about that in a little bit. But I was really just like enchanted with this term. Like, they didn't really mean it as a term, but we stand on the shoulder of giants, and uh I elaborated upon it, and as I really thought about it and elaborated, and I think can work very iteratively. I'm always trying to find out, like, how can I ensure that more folks feel seen and heard, that more wisdom is being incorporated from different perspectives, or being incorporated into the work, not just from an inclusivity perspective, but from a place of like, this is central to ensuring that we are, as best we can, um, uh, unsettling and decolonizing our practices. Um, so, um, so this talk is going to be called Centering Gender Pleasure, so beyond resolving gender dysphoria. So I want to displace gender dysphoria from the center of gender affirming care, where it really is at present. A little bit more about me. I engage in this practice. It's suggested by the family therapist Thandiwe D. Watts Jones, and it's called Location of Self. And it's about really, it's an invitation and to consider that, like, identity, social location, our histories, our trauma histories, the socio-political, cultural moments that we find ourselves are integral to the provider-client relationship. And indeed, the provider-client relationship is perhaps incoherent without discussion of and consideration of social location. So I am a white, queer, dyke, non-binary, trans, misogyny-affected femme. Femme is both my queer identity and my gender identity. I sometimes refer to myself as a hard candy power femme. I am kinky. I'm a leather dyke. I'm polyamorous. I'm allosexual. I'm married and without children, visibly able-bodied, neurospicy, thin, non-Zionist Jewish, and 45 years old, and then a bunch of other things. So I won't go into the rest of this, but because I really want to get into the content, but that's how I locate myself. And those facets of my identity constellation are really informing both the limitations of my work and also where the work emerges from. So to start off with where we are now is a dysphoria-based, dysphoria-centered framework. And this is steeped in what the French theorist Michel Foucault referred to in The Birth of the Clinic as the clinical or the medical gaze. And basically, he describes it as the ways that we as clinicians, as providers, fit our clients or patients, however you describe the people that you work with, presenting concerns or their problem-saturated narratives, if you want to use a narrative framework, within a biomedical framework. So, and so that basically it views the client and the patient as a collection of discrete illnesses or diagnostic criteria and symptoms that can and should be resolved through clinical or medical means. This tends to devalue a lot of things. It tends to, chief amongst which is other approaches, such as like ancestral healing traditions that are, and local knowledges. It tends to deprioritize the expertise and the wisdom of communities and clients. And we see this all the time. I mean, it's when, you know, we refer to a client as, well, they're borderline, you know, and so instead of like they have, they present with certain features that we have kind of lumped together as borderline, they are borderline. And so that subtly and sometimes quite unconsciously structures how we are relating, and it places a power dynamic that is not often addressed or deconstructed. How this plays out in gender affirming care is that there's a focus on transition, and especially medical transition pathways. It also enshrines a diagnostic model of care that puts the provider in the position of inciting speech, that's another Foucaultism, via a probing, assessing, unethical curiosity that entitles the provider to expect specific performances of presentation and expression from their clients or patients. So trans clients, we've had to learn particular stories to access care, which leads to clinician confirmation bias. There's stories about this. For example, 1966, Harry Benjamin comes out with the transsexual phenomenon, and with great intentions, by the way. Like, I'm not here to like poo-poo Harry Benjamin and his work, except that, you know, it's coming from a cis perspective, trying to describe trans experiencing from without. But it becomes the basis for what ultimately are called the WPATH standards of care. It becomes the criteria for admission to gender clinics in the 70s, 80s, and 90s. And basically, and I've seen this 3 to 6 months after the transsexual phenomenon comes out, there start appearing these periodicals that are excerpting passages from the transsexual phenomenon. And these are periodicals written by and for trans folks, and usually trans feminine folks. Why do they do this? They do it because they're betting that, like, if they learn this, that will give them admission. And so what this creates then is that when they would present to the gender clinics, they would all come with the story that, like, Benjamin had laid out in the transsexual phenomenon. And so they were like, oh my gosh, it seems that Benjamin was right, that this is exactly how trans folks are and what they need. And so it leads to that kind of confirmation bias. The big thing is that it defines and characterizing trans experiencing from without. And, you know, I dislike having my experiencing described by anyone who isn't me. But it also places a reliance on the gender dysphoria construct, which places resolution or alleviation of gender dysphoria in the ICD-10 and 11, F64.0 through F64.9 at the heart of gender affirming care. What is gender dysphoria? In the clinical imagination, and I'm am departing from the kind of clinical language that the DSM-5 uses, the ICD-10-11 uses, and just kind of putting it in a more colloquial statement. So it describes, or purports to describe, the discomfort or unease some of us feel in the incongruence between our internal felt sense of gender and the gender that is assumed of us or assigned to us at birth. So gender assumption refers to all of the ways that as we're moving throughout the world, we are constantly subjected to the assumptions of others who are encountering us in the world, who, make assumptions based on the way that we speak, the way that we move, the clothing that we wear, the appearance of our bodies, what certain gender stories of us, and then of course that moment of violence where gender stories are thrust upon us at birth. One thing I want to highlight here is that when we're talking about incongruence in the clinical imagination, we're talking about an internal felt sense and then an external presentation. And that gender affirming care is then about resolving that, making sure that the external matches the internal. As a construct, it's a psychiatric construct that emerges from 19th century sexology, and in particular from a term. This is the first recorded use of a sexual identity or sexual orientation, or even a gender identity term, Earnings by Karl Ulrich in 1867. He was a legal scholar who was trying to, in 19th century parlance, naturalize the existence of queer folks, and that we are part of normal human variation. And this concept of earning becomes inversion theory, or it's taken and used by sexologists to create inversion theory. Inversion theory is used by Kraft-Ebing. It's used by Havelock Ellis, and also Freud in the first of the 3 essays on sexuality from 1905. It's also one of the great lesbian literary texts of the 20th century. Radcliffe Hall's Well of Loneliness refers to the female invert. Kraft-Ebing refers to the female invert. And basically he describes it as the masculine soul heaving, I love that word, heaving in the female bosom. So this is where we get that kind of distinction, that there's a soul, an internal felt sense, a psyche that is, or an anima or animus, if you're using more Jungian frameworks, that is different from the expression. And basically the way that sexologists are understanding this is that they're saying, well, this is in part to allow for the preservation of the also emergent construct during this time of heterosexuality. And it's the idea that heterosexuality is preserved, thank goodness, because they were trying to attend to chiefly, how is it that men are having sex with other men or having romantic relationships with other men? And how do we account for this? How do we naturalize this? Again, that term. And he said, well, it's okay because one of the men, they don't ever consider if both men, but One of the men has a female soul, and the female soul is what is attracted sexually and or romantically to the male soul of their companion. But they both present as male outwardly, but they are different sexes internally, their internal felt sense. We see how this becomes gender dysphoria because, and Harry Benjamin takes this from, oh God, why am I blanking on his name? The Berlin sexologist. It's all the Nazi book burning photos are of his clinic, and he's an amazing guy. I'm trying to, but that's the through line from this 19th century sexology into Benjamin, and because he trained under him, and basically, so the whole purpose of gender affirming care, as outlined in the transsexual phenomenon, is okay. So we have this, say, masculine soul heaving in a female bosom. What are we going to do about it? So we're going to address it by ensuring that the body, or in this case, the heaving bosom, corresponds to the soul. So we're going to do that through medical means. Like many Western psychiatric constructs, it posits the individual's internal world as the source of the problem, and not the cultures in which they are moving and the stories those cultures are producing about sex, gender, sexualities, bodies, what is a good body, what is a bad body, what is good sex, what is bad sex, what is too much sex, what is too little sex, what it is to be trans enough, what it is to be too much, all these stories. If I think about gender dysphoria, the way that I prefer to think of it is as a nebulous, often nebulous sense of revolt that springs up when someone from the outside, a culture, a family member, a partner, a friend, tries to hang a gender story on us that does not fit us, that does not feel right for us. And I talk about it as that sense of revolt. It's that kind of like silent no. And that's how I understand it, because in doing so, it really does put the onus on. The problem is the stories that are constantly being thrust upon us, not the internal person, the internal world of the trans person and the need to fix something. I'm just going to pause here for a quick sec and just like check in with y'all. How is that sounding? Are you having any thoughts, feelings about this? And you can throw it in the chat, and I'll try to see it. Any questions that are coming up around that?
I'll keep an eye on the chat for you as well, Lucy. Or people can just unmute. We're quite a small group.
Yeah.
If I may jump in, what I'm really appreciating, Lucy, is something when I do a lot of my talks. So the beginning of my talk is a lot about the history of the evolution of, where we are now and everything that came before that kind of set the scene and the stage for the struggle that, in particular, trans and queer people face. And that I'm also, with my training within family therapy, the externalizing of or the use of externalization, and that's what I'm appreciating in kind of the reframing of the history, and I can see how you are working towards shifting that nuance, which I'm appreciating.
Thank you. And what does that already do for you when it is externalized? When do you notice anything in, how you're thinking about like how we're working with folks? Does that shift anything for you?
For me, two things. The first thing is something about when the moment is externalized, there's for me an increased sense of agency and power over the thing or the phenomenon or this experience that I'm, engaging with. And there was a second that's just, I'm blanking out like you as well. It's that sense of agency when I get to, and that sense of it now becomes this thing I can engage. The word in my head is that it shifts towards a depathologizing way of thinking. It's not problematized. It's something I can look at, have agency about, and shift my thinking on, versus this thing that is a label put onto me and that I somehow carry and don't have agency over.
Yeah. Well, and you're speaking as well to the kind of, the double-edged sword of labels and identity, that on the one hand, it helps us feel a sense of belonging. It helps us organize. These terms help us organize, and that is indeed why earnings was proposed as a term first. It was so that folks could organize and say like, in the modern parlance, we're here, we're queer, and and that's and the really sharp edge to that is that it does erase individual identification. It erases like, what is it about my story that may be different from another person's story, and how is that informed by various facets of my social location and some of the ways that the stories that I am considering are going to be different from others. Yeah.
There's a comment here from Shant saying, I absolutely love this move away from depathologizing to looking at the stories that are being told to us and about us, often rather than with us.
Yeah. Any other thoughts, questions before I move on and we get to gender pleasure? This perspective challenges the notion of professions and how we are constructed, because if we enter the clinical relationship by losing our expertness, then how do we continue our expertness? I think
maybe I can just add a bit. Sorry, I don't think I phrased it as clearly as I wanted to. It was quickly typing it out. It really challenges the way we relate to people, because our entire professional identity is premised on creating ourselves as experts in relation to other people. We depend on that in order to survive as professions. And so this challenge is huge. And I think it really will destabilize our identities as professionals.
I hope in some good ways, I guess, I'd like to think that, but yeah, I remember this is like first year of my counseling program. They made the distinction between, like you can be an expert on process, but you're not an expert on content necessarily. So like that is to say that what the client is bringing, or what the patient is bringing about their body, about their experiencing, you're not an expert on that. You are an expert on like how to hold space, how to, I don't know, it's one move. But I also, because, in a sense, it's like, it's a tension that I hold, certainly, because like I do believe that what I do, what I offer folks has, is a service that like should be valued appropriately. You know, if we're going to be all exploited under capitalism, you know, at least I want to, you know, I don't want to be, I want to make sure that the work that I do as a sexuality professional and as a you know, as a trans femme, is you know, is valued. I don't know if that passes through expertness. I don't know if it does or if it doesn't, but yeah.
I'm looking forward to the rest of it. Thank you for that.
Thank you. Okay, I am going to continue on just very quickly. I just want to note that, like, even the way in the popular imagination and in community imagination, when we talk about transsexualities and erotic embodiments, gender dysphoria is often at the center, both in research and in the popular imagination, dealing with, as in this article from the online site, Them, which is a great queer periodical, dealing with or finding ways to mitigate gender dysphoria seems to be centered. And I think about that and I'm like, well, if I fall back on my my undergrad in philosophy, I would say, you know, it may be the dealing with or finding ways to mitigate gender dysphoria, those feelings might be a necessary condition, but it's not a sufficient condition. So I want more for us. I want gender pleasure. Resolving gender dysphoria, I argue, shouldn't be the point of gender affirming care. Gender pleasure should be. And so now I'll talk about what gender pleasure is. Just quickly, we have other terms that we use to describe something other than gender dysphoria that is more of a yummy experience. We use terms like trans joy, gender good, gender euphoria. And if you or your clients or patients love or use these terms or use other ones, I'm not here to say don't use that. I'm not trying to be policing language. I'm not a cop. And I'm of the firm belief that, like, if one of these terms or another term appeals to somebody, then who am I to say, like, you know, oh no, that's the wrong term, you should be using this one. But I do think that there are some reasons why I no longer use the term gender euphoria. Gender euphoria, as described by Florence Ashley, a bioethicist, is the distinct enjoyment or satisfaction caused by the correspondence rather than the incongruence between the person's gender identity and gendered features, so the external self, associated with a gender other than the one assigned at birth. It's a great definition. It serves as kind of like the polar opposite of the popular understanding of what gender dysphoria is. But there are a couple of things that get stuck in my craw around gender euphoria. First, gender euphoria. First, it sounds too clinical to me. Like dysphoria, it's a term associated with mood states in a mental status exam. It sounds, you know, and so, like, I want, when we're talking about trans experiencing, I would love to break out of these clinical terms because because of the histories. The writer Virginia Woolf has this wonderful essay on words, and it's the only extant recording of her voice. And she talks about words, English words, so full of echoes, you know, and the marriages and pasts that they've contracted that they bring forward. Narrative therapists talk about how the language we use brings forth realities. And so I want to be careful about what realities am I bringing forth through the language that I'm using. It traps us in another binary when embodied experience is far more complex and nuanced. So like gender euphoria, gender dysphoria. My big problem, though, is that it sounds unattainable. When I hear a word like euphoria, I think that it has to be a peak experience. It has to be transcendent. It has to be and I want something that doesn't sound as much like, you know, the heavens are parting, choirs of angels are singing, shafts of light, all these things coming down from the heavens. I would much rather, you know, it, because like, it's not that I haven't had experiences like that from a gender perspective, but most of the time it's these everyday kind of experiences that I wouldn't classify necessarily as euphoric, but just kind of like, yeah, this is cool. Or this doesn't feel awful, or this feels meh, you know. So I wanted to find an expression that could describe things that are more grounded in a kind of body neutral perspective, rather than like a toxic positivity or a toxic body positivity perspective. So gender pleasure. This is where we get to the fun definitions. Gender pleasure is the pleasure one can feel in and or with one's embodied experience of gender or agender, whether that's encountering things out in the world that feel in alignment with one's embodied sense of gender or agender, or that are gender or agender relevant. So I think about Emily Nagoski's book, Come As You Are, and the way that she talks about sexually relevant contexts. So what are the gender relevant contexts that promote gender pleasure? So these can be things like, you know, that correspond to appearance. It's wearing, you know, like I love wearing corsets, for example. That is relevant. Corsets are relevant to my gender. A bold lip is relevant to how I do gender. It's not that a bold lip is intrinsic to being femme or feminine or anything like that. It's that for me, for the way that I embody gender, it is intrinsic to how I express my femme, not how anyone else has to. Another ways to get away from appearance, and I think about, in the last year, I've taken up powerlifting. And that is a very gender pleasure relevant context. What I do is I go in and I'm wearing my like really short shorts and my and you know, a tank top, and I'm showing off all my tattoos, and I just stride in and set the weights up on the rack, and I'm like, and I put myself next to the biggest douche bro I can find in that place, and I just park myself at the rack next to him and I lift his body weight. That is a gender pleasurable context for me. Another one is aerial silks. I love that feeling of, you know, it's something that I will never be an aerialist. I kind of suck at it, but it's this moment every hour that I spend in the silks, I'm not in my head, I'm in my body. And that feels really good to me because I spend so much of my life in my head. feeling affirmed in one's gender or agender within social, sexual, and or intimate contexts. So when I say feeling affirmed in this, I don't just mean name and pronouns, and I mean things like when we're talking about sex, the difference between gender dysphoria and gender pleasure for me is the energy and intention that is being brought to my body. If somebody is bringing an intention or an energy to my body that says, I know what this is, I've seen this genital configuration before, I'm just going to do what I do with this genital configuration, that is going to promote gender dysphoria. If I'm thinking about, but when I have a partner who is affirming me in my gender, in that context, what I feel instead is this sense of they're approaching my body from a beginner's mind and from a place of, I don't know what this is. And I'm just happy to be here. And I'm enthusiastic to be here with you and to enthusiastically delight in our bodies. And then finally, I kind of wanted an everyday grab bag, so it's just like feeling yummy in one's body at a given moment. Not fantastic, not amazing, not peak experience, but just kind of like, yeah, this is yummy. Sort of like when I do a five-minute dance party before I start my day and I pop on some Prince and it's like, oh yeah, I'm really feeling this song today. That is gender pleasure. That is a gender pleasure for me. It's relevant to my gender. So that's how I conceptualize what gender pleasure is. And I mark it out as it's slightly more expansive than, well, a lot more expansive than euphoria. There are some implications for clinical practice that I would love to lay out. First of all, it shifts away from a focus on alleviating symptoms and resolving a problem and toward a client's unique and empowered vision of healing. It becomes client-centered. It becomes about what are the stories you want to tell about gender or about sex, about sexualities, about your body. What meanings do you want to make of your body and its parts and your experiencing? And when we do that, some really cool things can happen. It deepens and enriches the client-provider relationship. And I'll give an example of letter writing. So now almost 2 years ago, I got I had top surgery. I had a breast augmentation surgery. In fact, I had two. I had one and then a revision a year later. And for the original one, when I worked with my providers to write the letter for it, we wanted the insurance my health insurance to pay for it. So we needed to establish medical necessity, and we had to ground it in gender dysphoria and meeting in many ways, the diagnostic criteria for gender dysphoria, even if gender dysphoria itself wasn't diagnosed. We at least had to meet the criteria. And so what we settled upon was this sense of, well, hormone therapy, HT, had promoted some breast tissue development, but not sufficient breast tissue development. And as a result, gender and body dysphoria remained unresolved. And so this surgery was meant to resolve that remaining gender dysphoria and body dysphoria centered around my breast tissue. Now, that wasn't a lie. That wasn't, me giving false testimony or anything like that. it's just not the point for me. Like, it's part of the story, but it's not really the reason for it. For me, it was because I wanted it, because I wanted particular experiences in my body. But like, I couldn't put that in a letter. I had to put all of the other stuff in there. But like, that doesn't mean that the relationship can't be marked by those conversations about, like, what are you excited about? What kind of experiences are you wanting to have? So for example, if I'm a surgeon and I have a client presenting who wants to pursue a vaginoplasty, instead of saying, well, sure, let's get you, here's the process. This is what we do. This is what the recovery's like. Here, we're going to engage in the risks and benefits of treatment and what the outcomes are. Let's talk about, what you want this to look like. Instead, what I want is, because often that can be steeped in a lot of assumptions about what is sex, and often those assumptions tend to be cis heteronormative. And so what I am suggesting is a shift of, maybe the surgeon asks, so what excites you about this surgery? What kinds of experiences do you think you're going to be able to have? And what kind of experiences do you want to have with your vagina, with your new vulva? And that allows the client to reflect on what is exciting rather than what is a problem. And it also gives more information to the provider, because suddenly they're like, oh, well, this person doesn't want to engage in penetrative PIV sex. This person is really more interested in clitoral stimulation, for example, or what, and so that may, have some bearing on the kinds of ways that the vulva is constructed, and what kinds of nerve potential and pleasure potential we're considering. It gives us as clinicians, and I think that this is really huge after almost 4 years of unremitting pandemic, that it gives us as clinicians a renewed and pleasure-focused sense of purpose. I mean, I don't know about you, but I don't know that any of us are okay. That I can certainly say that I'm burned out a lot of the time. And I think that sometimes I have lost focus on why I do what I do and why I work with the clients that I do. Centering gender pleasure renews and revivifies what I do for me. It brings me back to pleasure. This is what it's for. It's to help folks, support folks in finding pleasure and joy in their bodies. And that is something that I want to go to work every day to promote. And ultimately, as I intimated above, it ultimately gives us a better sense of client goals and aspirations. So here's some just like quick ideas about how to engage patients around sex, sexuality, and gender pleasure. One that I often like is, do you have any questions about how this intervention may affect your sex life? In the past, patients have asked about everything ranging from pleasure sensitivity and nerve function to how they can safely incorporate kink practices following this intervention. So I talked, for those of you who were coming in at the time, I was talking about flagging and the hanky code. This is the hanky for muffing. And this is an example of, I think, clinician flagging. It serves as an invitation that says, like, I am comfortable talking about sex and sexualities. I'm comfortable talking about kink. And I'm just laying this before you as something that we can talk about. And it's up to you to decide whether you want to trust me with that topic of conversation. But like, I am signaling to you, I'm flagging that we can talk about these things. You know, I'm my poor surgeon, you know, like I came in for like the 2-week post-op consult, and I said, so, you know, I have a partner coming in about a month, and I'm wondering, when can I, and they're bringing some rope. I'd like to know when I can get a chest harness, and like where the harness has to be. And there may be some impact on my chest. And so, like, what are we talking about here? What's permissible? And so, you know, like, but that's me. I am comfortable asking those kinds of questions of my providers. I'm a bull in a china shop. I just don't care. You know, it's I want to make sure that I'm not crossing any boundaries with my providers, but I also I'm not modest, and I don't and whereas like a lot of clients don't know that this is a topic that they can discuss, or that these are questions that they can talk about. As I said above, what excites you about this intervention? What possibilities might open up for you? What kinds of experiences are you hoping to have? At the very beginning, I talked about a gender pleasure mood board and a gender pleasure history. The gender pleasure history is described by Tuck in their essay in chapter 6 of Transsex. And basically it's a journaling exercise where you reflect on, and if we had more time, I might even ask you to you know, do a gender pleasure history. And if we don't have a lot of questions or things we want to talk about, I'm happy to you know, to do that with you. But basically, the gender pleasure history is like, consider how you've experienced pleasure in and with gender throughout your life. And I don't mean that to be chronological or to feel like it has to be something that starts in childhood. A question that cis folks often ask trans folks is, and not necessarily providers, but there's this question about like, what is your, as the advanced mental health class that we have a panel. I'm on the faculty of the advanced mental health training for WPATH, and there's a panel at the end of trans providers, and the participants proceed to ask, we're asked, you know, tell us a little bit about your history of identity development. And that's a question that always kind of like makes me bristle a little bit, because I always like to answer cheekily, when did I know that I'm femme? 5 minutes ago, 5 seconds ago, probably 5 minutes from now, you know, 5 days ago, 5 years ago. And so like, I'm not trying to like place this, I don't want it to be about like, you know, history being about, I have to locate this, that ever since I was out of the womb, I've had these stories. For many of us, that is the case. Like, I can look back and identify, you know, moments where I was really playing with gender and expansiveness in ways that would be exciting to me now, and in ways that I wish I had really deepened into at the time. But it's also, and I don't want to discount that, but I also want to make room for folks to constantly be renewing their relationship with gender, with their bodies, with their sexualities. The gender pleasure history, generally, I say, like, you know, consider the question for like 1 or 2 minutes, and then for, you know, 8 to 9 minutes after that, then just like spend that time writing down your responses, and then you can process it with the person that you're partnered with. And hopefully the person that you're partnered with will do the exercise as well, and you can kind of talk about what it was like to write that history. If you're more creative arts inclined, I've sometimes done with clients a gender pleasure mood board. And what this refers to is basically a collage, and you can do it digitally, or you can get out foam core and some glue and some magazines, and, you know, cut things up. But it's or use Pinterest or another kind of social media service where, like, you're creating a mood board to, like, what are things that are gender relevant? What are things that I think, you know, speak to the kinds of gender or agender experiences that I would like to have, and what's the mood associated with that? And they can be words, they can be images, they can be, you know, and it can be representational, it can be abstract, whatever you want. It's really open to the client to define what's on their mood board and how to talk about it. So I want to give like plenty of time for discussion, for questions, all that. So I'm going to end with this slide. This is how to get in touch with me via email. This is my website, and also my Instagram, Sex Beyond Binaries. I'm also, if you're on Blue Sky and part of the mass exodus from Twitter or X, then I am also at Sex Beyond Binaries .bsky.social. So thank you.